Thanks for tuning back into HSH TV. Today's episode is all about creating the best landscape for you to embrace self-infusing at home. First, let's cover some basics.
What is EMPAVELI, pegcetacoplan? EMPAVELI is a prescription medicine used to treat adults with a disease called paroxysmal nocturnal hemoglobinuria, PNH. Adults and children 12 years of age and older with a kidney disease called complement 3 glomerulopathy, C3G, or primary immune complex membranoproliferative glomerulonephritis, IC-MPGN, to reduce levels of protein in the urine, proteinuria. Important safety information. What is the most important information I should know about EMPAVELI? EMPAVELI is a medicine that affects your immune system and may lower the ability of your immune system to fight infections. EMPAVELI increases your chance of getting serious infections caused by encapsulated bacteria such as Streptococcus pneumoniae, Neisseria meningitidis, and Haemophilus influenza type B. These serious infections may quickly become life-threatening or cause death if not recognized and treated early. You must complete or be up to date with the vaccines against Streptococcus pneumoniae and Neisseria meningitidis at least 2 weeks before your first dose of EMPAVELI.
I always say our home is a tangible part of the soul, so creating a calming and healing infusion space for yourself is key to integrating your medication into your home. Wherever you decide to set up your infusion, it's important to make sure the space feels calm, well lit, clean, and as comfortable as possible. If you're able, try and make your infusion space a place where you can embrace your routine uninterrupted. Now that may be easier for some than others, but when and if you're able, try it. No matter the space, you'll want a flat, dry, clean surface for your treatment materials with enough light to clearly see what you're doing. Now, my rule of thumb is that comfort is just as important as function, and that's even more true when you're creating a treatment routine. Make sure you're checking in with yourself to figure out what you need to make your infusion space a place that you want to be in. Designing for calm can be totally different depending on who you are. We're all programmed in different ways, so it's really important for you to find out what makes you feel the most relaxed. Interview yourself to get to the heart of these answers and then incorporate that into your space, whether it's a candle, it's a piece of art that makes you smile, a comfy chair, a blanket, or a sentimental memento. Nature is calm. In my opinion, it can improve everyone's experience at home. Now, that may be tough if you're in the heart of a city, but even the tiniest bit helps. So, if you're in a position where you can't sit on a porch or by a window that overlooks a garden, I recommend cracking that window open just a tiny bit and turning on a playlist of whatever sounds are calming to you. I guarantee you there's a playlist out there that specializes in whatever you're looking for. Give it a listen and watch as your mood begins to shift. You could also start bringing the outdoors in by bringing home flowers or a plant. Super easy accessories that can help your body and soul settle down when you're self-infusing. Another way to go about encompassing calm into your infusion space is to create a collection of what you think you might need to be at your most comfortable. Apellis has actually created a few tools to help you design your perfect infusion space, like the Care Kit by Apellis, which provides you your choice of blanket, a neck pillow, and more. If you didn't receive a Care Kit by Apellis, then you can use your own comfortable pillow or blanket to help you relax during your self-infusion. No one person is the same, which means no one person will experience self-infusion in the same way. Embrace your uniqueness and make your infusion space yours in whatever way will make you feel most at peace.
EMPAVELI, pegcetacoplan, is a prescription medicine used to treat adults with a disease called paroxysmal nocturnal hemoglobinuria, PNH. Adults and children 12 years of age and older with a kidney disease called complement 3 glomerulopathy, C3G, or primary immune complex membranoproliferative glomerulonephritis, IC-MPGN, to reduce protein in the urine, proteinuria. EMPAVELI may lower the ability of your immune system to fight infections. It increases your chance of getting serious infections caused by encapsulated bacteria, including Streptococcus pneumoniae, Neisseria meningitidis, and Haemophilus influenza type B. These serious infections may quickly become life-threatening or cause death if not recognized and treated early. You must complete or be up to date with the vaccines against Streptococcus pneumoniae and Neisseria meningitidis at least 2 weeks before your first dose of EMPAVELI. If you have not completed your vaccines and your healthcare provider decides that urgent treatment with EMPAVELI is needed, you should receive the required vaccinations as soon as possible. You should also receive antibiotics to take for as long as your healthcare provider tells you. If you have been vaccinated against these bacteria in the past, your healthcare provider will decide if you need additional vaccinations before starting EMPAVELI. Vaccines do not prevent all infections caused by encapsulated bacteria. Call your healthcare provider or get emergency medical care right away if you get any of these signs and symptoms of a serious infection. Fever, with or without shivers or the chills. Fever with chest pain and cough. Fever with high heart rate. Headache and a fever. Confusion. Clammy skin, fever and a rash, fever with breathlessness or fast breathing, headache with nausea or vomiting, headache with a stiff neck or stiff back, body aches with flu-like symptoms, eyes sensitive to light. Your healthcare provider will give you a patient safety card about the risk of serious infections. Carry it with you at all times during treatment and for 2 months after your last EMPAVELI dose. Your risk of serious infections may continue for several weeks after your last dose of EMPAVELI. It is important to show this card to any healthcare provider who treats you to help them diagnose and treat you quickly. EMPAVELI is only available through a program called the EMPAVELI Risk Evaluation and Mitigation Strategy, REMS. Before you can take EMPAVELI, your healthcare provider must counsel you about the risk of serious infections caused by certain bacteria, give you information about the symptoms of serious infections, give you a patient safety card about your risk of serious infections, and make sure that you are vaccinated against serious infections caused by encapsulated bacteria, and that you receive antibiotics if you need to start EMPAVELI right away, and you are not up to date on your vaccines. Do not take EMPAVELI if you are allergic to pegcetacoplan or any of the ingredients in EMPAVELI, have a serious infection caused by encapsulated bacteria, including Streptococcus pneumoniae, Neisseria meningitidis, and Haemophilus influenza type B when you are starting EMPAVELI treatment. Before starting EMPAVELI, tell your healthcare provider if you have an infection or fever, are pregnant or plan to become pregnant. EMPAVELI may harm your unborn baby. Females who are able to become pregnant should have a pregnancy test before starting treatment and use an effective method of birth control during treatment with EMPAVELI and for 40 days after the last dose. Are breastfeeding or plan to breastfeed. You should not breastfeed during treatment with EMPAVELI and for 40 days after the last dose. Tell your healthcare provider about all the vaccines you receive and medicines you take, including prescription and over-the-counter medicines, vitamins, and herbal supplements, which could affect your treatment. If you have PNH and you stop taking EMPAVELI, your healthcare provider will need to monitor you closely for at least 8 weeks after stopping EMPAVELI. Stopping treatment with EMPAVELI may cause a breakdown of red blood cells due to PNH. Allergic reactions can happen during your EMPAVELI infusion and can be life-threatening. Stop your EMPAVELI infusion and get emergency medical care right away if you get any of these symptoms during your EMPAVELI infusion. Chest pain, trouble breathing or shortness of breath, wheezing, swelling of your face, tongue, or throat, feel dizzy or faint or pass out, fast heart rate, nausea or vomiting, feel confused or anxious, skin reactions including rash, hives, and itching. The most common side effects in adults with PNH treated with EMPAVELI are injection site reactions, infections, diarrhea, pain in the stomach, abdomen, respiratory tract infection, pain in the arms, hands, legs, or feet, low potassium in blood, tiredness, viral infection, cough, joint pain, dizziness, headache, and rash. The most common side effects in adults and children 12 years of age and older with C3G or primary IC-MPGN treated with EMPAVELI are injection site reactions, fever, common cold, flu, cough, and nausea. These are not all the possible side effects of EMPAVELI. Be sure to tell your healthcare provider about any side effect that bothers you or that does not go away. For more information, ask your healthcare provider. Talk to your doctor for information on EMPAVELI. Please see important safety information, including boxed warning regarding risk of serious infections and the accompanying full prescribing information and medication guide.